and welcome to Kudzi Chronicles podcast. I'm your host, Kudzai Mashaya, and I am so honored to have someone who I have admired for a long time from afar, someone whose content I enjoy and I watch. I've been watching for a long time. So, yeah, I'm so honored. Hi, Miss Vix.
Hi, thanks so much for following along on my journey all of this time and being inspired by my content. I'm honored to hear that.
Yeah, your content, it just feels so down to earth and genuine. It's like, yeah, there's just so much authenticity on there. I've been watching and it's just so nice. Yeah.
Thank you.
You're welcome. Okay, now let's get into it. My first question is, what inspired you to go into medicine?
Honestly, I saw a need for it as a kid. I never really had a doctor that looked like me, someone who I felt
Mm-hmm.
super comfortable disclosing like my truth with due
Yeah.
to that lack
Yeah.
of cultural competency. Although my
Mm-hmm.
pediatrician was understanding and viewed the social determinants of health when providing care to me, but she also directed every single question to my mother. Nothing
Oh,
was explicitly directed towards me.
mm-hmm.
But at the end of the day, I just know that there's a need for medically disadvantaged and underserved communities to receive equitable healthcare. Healthcare is not
Yeah.
something that dependent on how much money you make or your social status in
Yeah.
society. That shouldn't dictate
Yeah.
or determine the level of care that you're receiving. So I always tell people that the hood need love too. And like I
Yeah.
plan to be a doctor for the hood. And so that's literally why I'm here.
I love that. Oh my goodness. Would you say you have faced any challenges yet or no?
Can you say that again?
What would you say are the challenges that you have faced so far?
Huh. I mean, how long do we have? Because I have faced countless challenges.
Girl, we have all the time. We have the whole day.
Being first gen for medicine is extremely
Yeah.
difficult because I've been learning things as I'm going versus having a blueprint already printed out, which is likely the reason why my mother wanted me to create this platform so that other students who were have a
Could
similar story as mine
learn.
don't have to also figure it out as they go because it's painful, it's
Yeah.
costly. In undergrad, I struggled with the pre-med classes, was told I should do a post-bac program. I didn't even know what a post-baccalaureate program was. And it is taking the
Hmm.
pre-med prerequisites after you've obtained your undergraduate degree. But I had no guidance on, okay, well, what program should I apply to? Like, should I just go to a
Yeah.
community college where I take the classes, or do I need to be in a structured environment? So that led to me
Mm-hmm.
doing 3 post-bac programs, not one, not two, but 3. And that was
Woo.
expensive. I took out loans with Sally Mae, which is a private lender. My first post-bac program,
Mm-hmm.
which was just like ridiculous, still in so much
Oh
debt
my
with that.
goodness.
And to keep that in perspective, I graduated undergrad with 0 debt. Like I had expected family contribution was low because
Yeah.
I went to a
Yeah.
need-based school. So I don't come from money. So they were like, well, we can't require you to spend money you don't have. Got a lot of
Yeah.
scholarships. Did that post-bac
Yeah.
program. I came out with so much debt and variable interest rates that are just ridiculously high. Second post-bac program,
Mm-hmm.
I only paid for the first year. The second year, since I was getting a master's degree, I got an assistantship where they paid me and I worked. So they also paid for my
Mm-hmm.
tuition. The third post-bac, it was directed towards minorities in medicine. So they gave us a stipend to be there. So it was free. So it was really that first one that put me in debt. So that's one setback,
Mm-hmm.
right? Not getting the grades in undergrad to be
Yeah.
where I am
Yeah.
now and going to post-bac programs and paying all that money. So then the next setback was the MCAT. I got to undergrad. Well, I always knew I wanted to be a doctor since I was like 10 or 11. I want to be a doctor. I want to be a doctor.
Mm-hmm.
What the heck does that
Mm-hmm.
mean? Like, how do I get there? How do I become said doctor? So
Yeah.
I didn't know what the MCAT was at the end of my first post-bac program, of which I did not finish because I got a C or a C minus in biology. So you cannot
Oh.
continue with the next course if you get a C or a C minus, whichever one it was. So
Mm-hmm.
I took the MCAT without finishing biology. I got a 13. To put that in perspective, I think the highest you could get was like, let's say a 35 or a 40. So I scored in like the 5th percentile, very, very low. And then I did
Mm.
a test prep course, took the MCAT again. Let's just fast forward, wound up taking the MCAT 5 times. So those are setbacks because
Wow.
each time you take the
Wow.
MCAT, you're paying money to take the MCAT.
Yeah. Yeah.
In medical
You have to
school,
pay.
I have like failed some exams. I had to retake my board exam multiple times. And I'm currently studying for my second board exam. But in part, I took the board exam multiple times because I didn't have testing accommodations. I was diagnosed with attention deficit hyperactivity disorder in medical school.
Um,
So it's like I'm a full blown adult. And these things, I find myself in these situations or these predicaments, but I don't want to paint the picture as though I'm a victim because I am not. I am a work in
yeah. Yeah.
progress, constantly learning how
Mm-hmm.
to navigate and evoke change in my life, positive change that will not only help
Mm-hmm.
me to be better as a person, but to help me be better as a physician.
I love that. And your journey really is just inspiring everyone. I'm sure that everyone who watches, everyone who is a part of the Medi to Medicine journey, the family, I mean, everyone is just inspired. Everything is just seems, and to us, I don't think anyone would know that you have been through all that. Yeah, it's only when you share now that people realize that, oh, you have been through all this, but really we wouldn't know because you just carry yourself so well and just the content is amazing. So yeah, I
Thank
really love that.
you.
Yeah. So what would you say has been the best part so far?
The best part is seeing patients and being in
Yeah,
a room with patients and them saying like, I'm so proud of you and keep
yeah,
going. What
yeah.
you done? Like, oh my gosh, so you will really be my doctor then. And I get so much fulfillment and thrill
Mm-hmm,
and
mm-hmm.
excitement, joy around
Yeah,
helping my patients, connecting with them, building that rapport. Like I started
yeah.
on family medicine, then I went to obstetrics and gynecology, then I went to pediatrics. And so I had some patients that I'd seen on obstetrics and gynecology who were pregnant. And then I get to
Yeah.
peds and I'm in
Oh,
the mother baby unit. And I was like, wait a minute, this patient looks so
that's
familiar.
my baby.
Oh my gosh,
Yeah.
you're my patient. And now your baby is my patient. This continuity of care, like I
Yeah.
want that real bad. So
That is so cute.
that's the most exciting to like, actively work with patients. And then number two,
Mhm.
when I get the diagnoses right, like to just see my growth and progress
Thank you.
when I first
Thank
started
you.
third year, December
Exactly.
2023, to now it's April or wow, it's May. It's May
Mhm.
2025, and I've really come so far.
Yeah.
All of that doubt and imposter syndrome, I was
Mhm.
confronting my first year, my second year, even throughout third year, to just see that not only am I doing it, I'm doing it pretty well. So that's
Yeah.
exciting.
Yeah. I love that. And I love that you mentioned imposter syndrome, especially, in our field, in the medical field, where you're surrounded by everyone is an overachiever, right? Everyone is trying their best. Everyone wants to be the best. And so it's really easy to feel like, am I really made for this? Is this really my thing? And so, yeah, I really love that in your journey, you're just showing everyone that, you know what? It doesn't matter where you're coming from. It doesn't matter who you are, what you've been through. You can still put in your best and still succeed. So I do really love that. And you mentioned getting the diagnosis right. Please. Yes, it just feels so nice when you get it right.
Yes, like
That's
literally, I'm
so
like, oh,
true.
that's studying. It's been helping. Look at me. So yeah.
Yeah, yeah, I've come a long way, right? So, what would you tell someone who's going for their clinicals in a few months? Because I'm going for I've never been to a hospital actually. Like as a medical student, I've never been. I will be though in a few months from now. So what would you tell someone like me who has no experience at all? Everything they know is theoretical. Yeah. So what would you tell that person?
I really think like honing in on your people skills, people underestimate that so much.
Mhm.
And
Yeah.
these are real people that we're working with. These are not practice questions. This is not a vignette that you're reading. And at the end, you're like, oh, well, this is the leading diagnosis. Like, this is someone's real life. People are multifaceted. They are complicated. And
True.
it's important to go into the room. Yes, you need to have a differential diagnosis because this is medicine, right? But you also need to connect with your patient. If your patient does not trust you, you won't get anything. And it's going to make your job that much more difficult. So, like, obviously work on the people skills and like you're listening, be an active listener, sit down when you're talking to patients, try to be eye level with them. If you can't sit, kind of like lean to be eye level because if you're standing, they're sitting, they're laying, then it's giving an authoritative position. And we have to remember that medicine is a collaborative sport. I can't do anything if you don't work with me. And I never want to go into a room telling a patient that I'm the expert because I'm not. You are the expert in your life because you live with me 24/7. I see you for 15, 20 minutes. Like, so I'll never paint that picture that I know more than you because I'm getting all of the knowledge that you know, and I'm trying to use it on the medical side to better assist you, right? And number two, whatever rotation it is that you're on, study. Like, do your research. Study. It goes beyond the hospital, it goes beyond the clinic. You need to continue to work on it. All the things you've done in preclinical years and with your studies, with the books and the lectures and the study groups, all of that, like now you have to put it into practice. And clinical medicine is different than preclinical medicine. Like, yes, the content is very similar, but you have to think more and be more like using your critical analysis skills. So like there are certain books that I would use, like case files for a majority of my rotations. I use that because it's like a very short blurb, maybe 5 pages of, let's say the topic is pneumonia. So give me all the indications for pneumonia, the treatment, what it looks like in neonates, the general population, elderly, those who are immunocompromised. How do we treat it for each segment? And what are the symptoms that they're going to present with? And just constantly refresh on things like that. That's going to have you sharp and prepared for the wards.
Thank you. Thank you for that. Because I think most of us preclinical students study to pass. We studied to just pass the exam and go to the next thing. And so now going to the clinicals, I think it's important to remember that you're not only studying to pass, you're studying to know these things, to actually remember these things and use it for the practical things in the hospital. Yeah.
Absolutely.
So right. Okay. So tell me, because you're also a content creator, right? I know your content is mostly based on medicine, but you're a content creator. So where is the balance? How do you create that balance between being a content creator and also being a student?
It's hard. It's so hard. And I think my first year, yes, very hard. Because I mean, I have to edit. And editing takes time.
It looks so easy. Like when you do your lives.
Nah, I mean, study with me lives are the easiest thing. And they hold me so accountable to studying. And this week, I had no study with me, and I have not studied as adequately or proficiently as I should have been. But, that is the easiest thing because I don't edit. It's real time. It's real deal. It's me. So I'm just studying, right? But when I'm putting out content like videos, and I aim for my videos to be between 20 and 30 minutes, I have to rewatch them. So then I have to edit them. And now I do a lot less edits just because it's very time consuming being in third year. My first year of medical school, I committed. I'm like, I have to drop a video every single week on Wednesday at this time. I have to do it. So I would be staying up late at night on Tuesdays trying to edit. And I talked to my brother. He's like, you're your own boss. Like, if you don't meet the deadline, you don't meet the deadline. No one's going to fire you.
Exactly.
And I was like,
there's no one to impress.
There's no one, right? And so when he said that, I'm just like, okay. So now, I try the goal is to put out a video every week. And sometimes I fall short, and that's okay because the real goal is to graduate with this MD and become a physician.
Thank you.
And yes, although I do want to continue to update y'all on my journey and how things are going, my thoughts, all of that. But at the same time, what is the journey if I don't finish? So I'm just trying to balance what I can do and be as efficient with doing so. So YouTube probably takes me the longest because that's long form content. Instagram and TikTok, I just kind of started getting into TikTok for real, trying to find my niche with TikTok. I was trying to do like essentially reel based videos for TikTok. That wasn't really working for me. So now I just go on there. If something's on my heart, I record it in 60 seconds and I post it. I don't edit anything. I just post it. Like, y'all just about to get my thoughts in this moment. And, but I will say, like, the biggest thing with being a content creator is your consistency and just showing or deciding how you want to show up. Like, what is it that I want to share with you about my journey? Do I want to only share the good times? Do I only want to share the bad times? Do I want to do a mix? Do I want to share like study habits, study techniques, what my day-to-day looks like with faculty at school or with friends, you know, like what aspect or how do I want to show up for y'all on the camera? So it's very dependent, but I will say, like, as time has gone, I've been a content creator now for 4 years. So it's definitely a lot easier now. And I don't beat myself up. If I can get it done, I can get it done. And if I can't, I'll be like, you know, the content's on my camera. So eventually it'll be out there for people to see. And right now it may not. Doing my best.
Wow, thank you so much. I love to hear that from you because, you know, I just recently started posting on YouTube. I recently started my podcast. And so, you know, when you're starting something new, you just want to put in all the effort. You just want to do all the work that you can. And with school, sometimes the balance is just not there. You cannot do it. Exactly. And so I've really just been trying to tell myself that, you know what? No one is watching me. I can do it when I can. And when I don't, it's okay.
Literally, when you can. Just keep the main thing the main thing, right? Like
exactly, because the main thing is medicine. Exactly.
The main thing is medicine. Correct.
True. Thank you. Thank you so much.
Of course.
Yeah. So tell me, what would you say has been your favorite rotation so far? What's your favorite rotation?
That's a great question because I ain't even said that on my YouTube
channel. Let me guess. Let me guess, please.
I mean, guess. I can't say that I'll confirm or deny, but sure.
Oh, you know what? Let me try.
Oh, what's your guess?
Okay. My first guess is psychiatry. And then maybe peds. Yeah, psychiatry and peds.
Okay, and why would you say psychiatry or peds?
Because I've just recently been seeing so many videos. Most of your recent videos are about psychiatry. Confirm.
No, because that's the rotation I was just doing. I do it.
Oh, yeah. But you can say you love it. Yeah, you said you love it. I saw in one video.
Okay. So
you're really not going to confirm?
So, I mean, no, I can confirm this. I feel like you didn't watch the whole video because I said I'm a miss psych. I haven't done my full recap video. Maybe that's why too. It comes out.
Yeah.
Maybe next week or the week after next. I don't know. I haven't edited anything yet. But
yeah.
Psychiatry is really something. And on day one, I decided, I would never do psychiatry. It takes psychiatry is gonna take a lot from those providers mentally, emotionally. I think it's a very needed specialty, right? But I think all specialties are needed, to be honest. Somebody's got to do it. It won't be me. But I also think that psychiatry is integrated in every single specialty, minus like a few, maybe like not pathology or diagnostic radiology. But for the most part, you have to be aware of someone's psychiatric needs. No matter what you go into, like you've been on surgery right now, I need to know, like, you know, if someone presents with altered mental status and they're not sleeping and I know they're having hallucinations, that could be delirium. And so now I need to know, is it delirium because of a surgery or is it delirium because of a mental condition or a general medical condition? Like, you know, psychiatry is very pertinent, but I would not be a psychiatrist. No, that's not. I did enjoy my pediatrics rotation, though. I will tell you that. I did.
Yeah. I love that. Okay. So we did not get a confirmation on which one is the favorite, but okay. We appreciate the information that we got.
Yes.
Okay, I love that. So, in my last interview, I just had an interview recently, and this doctor was sharing that it is a bit different for women in the hospital than it is for men. So, in your perspective, is that true? And yeah, what's your perspective on that?
I mean, bias is everywhere. And this
Yeah.
world was created for men. Women are
Mm-hmm.
just,
Yeah.
or individuals who have a uterus, they are just the ones who bring men into the world, you know,
Yeah.
the conduit, you know, if I must,
Yeah.
but don't get a lot of
Yeah.
respect if you are not a cisgender male. And it all
Mm-hmm.
depends, though, it's person to person basis. I haven't necessarily experienced a lot during my rotations, but I have noticed the treatment that I receive when I'm working alongside a man, and
Mm-hmm.
especially if my seniors are also men.
Yeah.
I kind of can get like exiled or ignored a bit. And you kind of like,
Really?
yeah. But I mean, like at
People do
times,
that?
yeah, people do. I mean, bias. People are human. Humans are not robots. You know, you could program a robot to behave a certain way, but humans are conditioned based
Yeah.
on their lived experiences. And you know, it happens, but I try my hardest not to take things personally. I'm here to
Yeah.
learn.
Yeah.
I'm going to show up, and I'm very good at advocating for myself in addition to my patients. So, you know, you can
Yeah.
try to treat me a certain way, but if there's something that I need, I'm always going to request it. And again, like sometimes people are unaware of the bias that they
Mm-hmm.
are holding.
Yeah.
And so sometimes they need a little reminder, you know, just
Yeah.
give them
Yeah.
a nudge and, you know, just try to move from there. But at the end of the day, like Glorilla said, at the end of the day got to end. So I'm not going to lose
Yeah. The
sleep
big that
over
I
something that's minor, right? And all of these
Mm-hmm.
rotations are finite. They have an end date. So I just try
Yeah.
to remind myself that like literally trouble does not last always. So, you know, if someone's difficult to work with, then all right, when is our time running out? And like that's fine.
Mm-hmm. Yeah. Yeah. I love that. It still scares me though. It still scares me because I feel that, with my personality, I'm working on that. I'm going to be strong. Because I'm not ready for that bullying and being ignored. Don't ignore me. Why are you ignoring me?
Um, I will not say bullying, and I don't condone bullying on any front.
Mm-hmm.
So if
Yeah.
you ever feel like you're being bullied in the hospital, there are several people that you can reach out to, your clerkship director, your clerkship
Yeah.
coordinator, a trusted faculty member at the school. You can even at my school, we have forms that we could submit when there is
Okay.
some like negative interaction has occurred and you feel like it could negatively impact your evaluation. Or if you
Yeah.
just have spoken to other students, it's like, oh yeah, I also experienced that. But if no one reports it, then nothing can ever get done about it. So no, I don't
True.
condone bullying. And if someone has, no one I will say has ever bullied me, like ever.
Yeah.
And if they were
Yeah.
to, I mean, I'd have to go through the proper channels to address it because bullying is not acceptable on any front.
True. True. Wow, Miss Fix, this was so awesome. I'm so thankful for your time. You were so generous with your time. And the long, long journey that we went through to get here is it was all worth it. So, yeah.
No problem. I wish you the best of luck in your
Thank
clinicals.
you.
And, you know,
Yeah.
keep going. We need more Black medical providers in the world because
Yeah.
the research has shown that cultural
Mhm.
competency produce improved patient outcomes. So when people look
True.
like you and they've experienced life similarly to you, then they
Hmm.
are more likely to be compliant or adhere to, you know, health, um, I guess health advice or
Yeah.
also work in collaboration with you. Like my whole thing is I'm really big on advocacy, but also we need to work together. Okay. Like
Hmm.
it's always
Yeah.
about the two of us, the three of us, whomever's in that room working together to achieve
Yeah.
your goals. Like whatever your goals are, I'm gonna help you to work to get there. So yeah, keep going. And thanks again
Thank
for having me. I
you.
really appreciate it.
Yeah, I am so proud to be a part of the Medi to Medicine family.
I'm
I
happy
feel like
that
I know
tell
stuff.
everybody, tell all your people to subscribe to
I
the
know all of
YouTube.
friends. Everybody's coming.
Listen,
Yeah.
everybody, let me go ahead and plug that real swiftly. You can catch me on
Uh-huh.
YouTube,
Yep.
Instagram, and TikTok at
Mhm.
Made to Medicine. And Twitter is
Uh-huh.
medicine_made. But yeah, we out here just showing
Why
and sharing
not?
my journey with the masses so
Yeah.
that less people can encounter the obstacles that I have lived. And more people will know that
Exactly.
there's also more than one route to get to your
Yeah.
destination. So here we are.
That is so true. Oh my goodness. I cannot believe I had you on my podcast.